Hello there. Today we're going to talk about otitis media, but first we're going to give you a brief introduction about the anatomy of the middle ear along with some physiology. The middle ear is the part of the ear between the eardrum, the tympanic membrane, and the inner ear, the oval window. Its main function is to conduct sound. One of the most important features in the middle ear is the eustachian tube, which is a narrow tube that connects the space behind the eardrum, the middle ear, with the back of the nose, the nasopharynx, in order to keep the air pressure equal on both sides of the eardrum. In this way, the middle ear is somewhat in contact with the external environment and plays an important role in ventilation and clearance. I'll come back to the tube in a few minutes. Now, when it comes to sound, it's actually quite simple. Sound waves or vibrations travel down the external auditory canal, which is the fancy name for the outer ear, and then strikes the eardrum, the tympanic membrane. The eardrum vibrates. These vibrations are passed down to three tiny bones in the middle ear called ossicles: malleus, incus, and stapes. These bones transmit the vibrations to the cochlea in the inner ear, which then send signals to the brain that are later translated into words and sounds. Now on to the star of the show, otitis media. Don't let the name scare you. Otitis media is basically the inflammation of the middle ear. It's that simple. Otitis media has three major categories, which are acute otitis media with effusion. Some books may use a different name depending on the type of effusion, such as serous otitis media and secretory otitis media, and chronic otitis media. When you think about it, the outer ear is basically the continuation of skin into the ear, so it makes sense that they'll have the same normal flora, which are Staphylococcus auricularis, Staphylococcus capitis, Staphylococcus epidermidis, and Pseudomonas aeruginosa. And as for the middle ear, you would think that the tympanic membrane would protect it from microbes, but due to the eustachian tube, which is usually sterile because mucus and cilia in the nasal cavity trap and expel bacteria, some bacteria may travel through the eustachian tube, which is connected to the nasopharynx. So that means it's going to have similar bacteria to the nasopharynx, like alpha hemolytic streptococci. Just remember that in order for the bacteria to travel up to the middle ear, it has to pass mucus and cilia in the nasal cavity. So you won't find a lot of microbes in the middle ear. Since we mentioned the anatomy and some physiology and normal flora of the middle ear, I think we're ready for some pathophysiology. So organisms invade mucous membranes, causing inflammation, edema, and pus. Edema closes the eustachian tube, preventing drainage. Pressure from the pus increases, causing the eardrum to perforate. At the end, most cases resolve completely with no complications. Now, for the most common organisms in acute otitis media, we have Streptococcus pneumonia, Haemophilus influenza, Group B Streptococcus, Staphylococcus aureus, Moraxilla catarrhalis, and Pseudomonas aeruginosa. But remember that it could be viral, such as rhinovirus, adenovirus, parainfluenza, and coronavirus. Acute otitis media, in this case, pus accumulates or gathers behind the eardrum and is extremely painful before the eardrum perforates, and mainly occurs in children or infants aged 6 to 18 months because they have horizontal and short eustachian tubes. It usually lasts for 1 to 5 days if it's a bacterial infection, but if it's due to a viral infection, it may last as little as a day, but can persist. Recurrent otitis media just means episodes of acute otitis media that occur more than 3 times in a 6-month period. Acute otitis media is common and frequently bilateral. Most children will develop 1 or more episodes before the age of 2, and may be the result of an upper respiratory tract infection. Acute otitis media is usually due to Streptococcus pneumonia, Haemophilus influenza, and Streptococcus pyogenes. The symptoms of acute otitis media are the following. You have the throbbing earache. The child will cry and scream and yank his or her ear. Once the eardrum ruptures, the child will have immediate relief. There will be some discharge after the eardrum ruptures, but is usually self-limited. The child will usually have a fever above 40 degrees centigrade. Deafness is always present in acute otitis media, but resolves after treatment. Acute otitis media with effusion is thick and sticky fluid that accumulates in the middle ear behind an intact eardrum. Note that after acute otitis media, some fluid still remains in the middle ear for several weeks, which is normal. In order for us to use the term acute otitis media with effusion, fluid must persist for at least 3 months. It's not considered to be infectious. Now, in chronic otitis media, the eardrum has ruptured and has failed to heal with an ongoing infection. This leads to mixed infections and further damage to the middle ear, along with worsening conductive deafness, and is usually due to late or insufficient treatment of acute otitis media. The symptoms of chronic otitis media might be similar to that of acute otitis media, but not always. Now, treatment for different types of acute otitis media. For acute otitis media, we usually use analgesics, but remember we have to avoid aspirin in children because of the risk of Ray's syndrome. We use antibiotics like augmentin, which is a combination of amoxicillin with clavonic acid, and we also use cephalosporin. And in some cases we do what is called a laryngotomy, in which we create a small hole in the eardrum to either drain the pus or relieve the pressure. For chronic otitis media, we usually do what's called a laryngoplasty, which is the repair of the tympanic membrane, and it's also called a tympanoplasty. Now here I just put this picture to show you guys what a laryngotomy looks like. So basically, as I mentioned before, we slit a small incision in the eardrum to relieve the pressure or drain the pus. Now, as a result of incompliance to medication, complications occur in the intracranial and extracranial spaces. Serious intracranial complications are like meningitis and brain abscesses, and external complications such as acute mastocytitis and facial paralysis, labyrinthitis, and not to mention hearing loss. Thank you, ladies and gentlemen, for your cooperation. Have a great day.